Are you trying to manage lipedema or lymphedema on your own and having a little difficulty? Today's video, I want to break out why these things are super important. What are they? How do you use them? And I want to share with you some techniques that will help you minimize the fluid and fibrotic tissue of your abdomen, your sides, your butt, and your legs, and minimize swelling and your fluid levels in today's video. Welcome friends, I'm Dr. Melissa Gallagher. I'm a naturopathic physician and I'm a specialist in lymphedema management and lymphedema lymphatic disorders. And lipedema and lymphedema is the topic today. This is part 2 of a video series specifically aimed at addressing your questions. Many of you have emailed me saying, I'm watching your lymphatic related videos, I'm doing all your DIY exercises. Here's a really good link to some if you haven't checked them out. But you need a little extra help. And one of the main questions was, Melissa, my doctors aren't really giving me a whole lot of options, or I'm not getting anywhere, or I'm wearing some compression garments, but they're not working, or I'm not sure what to do. So today's video, I want to break out and explain a little bit about compression wraps. So these are garments for folks with lymphedema, particularly I'm focusing on lymphedema and lipedema. So this is a condition of fat disorder that causes additional swelling and lymphatic related fluid retention in particularly the lower abdomen and the legs. And if you are unfamiliar with what lipedema or lymphedema is, you can check out this video. This is part 1, where I explain a little bit more about that particular diagnosis. Today's video, I want to answer several questions about how do I manage this on my own, because the reality is lipedema or lymphedema is a permanent situation. It is genetic. It is chronic lymphedema. If it is not managed daily with an assortment of protocols that I'm going to be providing here to you in this video, and I also have an email course. If you want to sign up for that, you can do so here at this link, or I'll have registration down below where you can be a part of some additional materials and resources that I provide for free for you so that we can get you better managed. What I want to do is I want to introduce you to compression therapy, compression wraps, and compression garments. In this video, this is really the most important and most crucial aspect of managing lipedema and lymphedema, as well as any of my lymphedema extensive swelling cases. I've been doing this for over 12 years now. I've worked with over 100,000 patients in clinical settings, in inpatient and outpatient settings, and many of you virtually I've worked with to help manage your swelling at home. And one of the things that I find is the most important when you're not working with an individual like myself who's a lymphatic therapist or a specialist in lymphedema disorders is your home care, everything that you're going to be doing when you're not seeing us in treatment plans. And so this particular type of garment, this is what I recommend. I'll include links down below to purchasing these products. I'm a huge fan of Juzo. They're one of my main wrapping resources. It's a company, it's a European company. They are based here in the US. They manufacture compression garments and stockings like this one here. So I want to break out how to utilize compression therapy, what type of compression therapy tends to work best for each different type of individual that might be dealing with lipedema and lymphedema. If you watched my first video, you know every case is unique and different. And so I like to try to create tailored plans. But in general, this video, I want to impart some information that you can use to begin your consistent daily treatment plan and protocol at home. What I want you to do is to gather some materials. So I'm going to list out the materials we're going to start with. Some of them you might actually have to buy. I will provide some affiliate links. They benefit my channel, but really this is about you and giving you a toolbox of resources to begin to manage the swelling and manage the fibrotic tissue that often accompanies lipedema and lymphedema. So the first thing that you want to gather up is a dry skin bristle brush. This usually comes with a handle, but I just want to show you what this is. These are easily purchasable at your Walmart, Targets, online. You can buy them off of Amazon. You can actually find them at a lot of drugstores. The trick with this is you want a vegetable bristle, natural bristle, not synthetic. You don't want a loofah or anything like that. You want a body brush. And this is the beginning of the protocol that I recommend for a lot of folks that are dealing with lipedema and Lipo Lymphedema. If your legs or areas, back, sides, are hard to access, you definitely want to make sure you get the one with a handle. For the purposes of demonstration, I'm just going to be using this one. I actually like this because the handle pops in, pops off, and then you can put your hand in. So buy the lymph brush that is, or body brush that is the most comfortable for you, but this is the one that I recommend. Second, you want to definitely incorporate homeopathy. So I'm a homeopathic provider, along with a lot of the different specialties that I do. Homeopathy is a big core of my lymphedema management practice. And the one that I find the most helpful is a product called LipoStim. This is a professional grade product. You cannot find this over the counter. You're not going to find it on Amazon, but you will find it in my online store. I'll link here. All of my new patients who are purchasing this online, you actually need to enter in a patient code. It's standard for everybody. It's 6010. So that's the code that you'll enter and you can get right on in. This is a 4-ounce bottle of homeopathic LipoStim. This is an assortment of homeopathy that motivates the lymphatics and gets the fluid moving, starts to break up and decongest that fibrotic tissue and really start to help your cells release toxins and release fluid that they're holding on to. That is going to be crucial in our daily management. The other thing that is going to be absolutely essential is going to be compression therapy. And compression therapy is simply put, we are going to compress, we're going to put pressure on the skin and the particular type of extremity. So we'll use our leg as an example. We're going to be compressing an extremity that is filling with fluid and not moving. We call it stasis. There's fluid stasis, stagnancy. We're going to compress and we're going to utilize the compression from the lower space up to the top space to actually move the fluid up the body. This is impactful for ankles, for knees, calves, thighs, butt, abdomen. It will also be impactful for the pannus. This is the space or the area, the low abdomen that can sometimes hang to the mid-thigh area and even sometimes reach down to the knees. There is compression therapy that we can impart and utilize for the abdomen region. And what's really key here is compression is one of the most impactful ways, on top of laser therapy, to be able to break up fibrotic tissue. And with lipedema and Lipo Lymphedema, a lot of times the legs will have this kind of curvy type of effect. It almost looks like, and I don't mean any offense to this, I just want to be able to describe how folks look. But a lot of times the storage of fat, which is the lipedema situation, it's an excess, it's a fat disorder where we're storing excess fat cells in greater accumulation in the abdomen, the side, we call it the love handles or the side handles, sandal bags, whatever you want to call it. It's on the side of the torso and really on the side of the hip, and then the butt. And then it extends down where we have the pannus, which is the lower abdomen, that can be dipping below the pelvic region and be actually hanging and touch the mid-thigh and knees. Then we also have where the legs are expanded with fluid, but there's this kind of curved, almost like marshmallowy type of structure. Lipo Lymphedema, lipedema has a very specific kind of curvature. I'm going to show you this picture from a patient of mine. This is what a traditional lipedema case looks like. Regardless of the staging, this is what it looks like. And as you can see, it's very specialized in terms of the roundness. And sometimes there's pockets of fluid hanging below the knee. What we do is we use specific compression. Most of the time when you're starting off with actually utilizing compression garments, there's several different types. The lower level that I actually don't involve in a lipedema, Lipo Lymphedema case are like stockings, compression knee highs, compression thigh highs. I don't get into that because of the lipedema and the kind of circling, this kind of marshmallowy type of situation with the fat cells. And and sometimes there'll be pockets and even some infections and wound management underneath those little round areas. Compression therapy that is higher grade, 20 to 60 is what I like to see for compression garments, and that's where we get into the Velcro wrapping. So I first want to share with you, you would normally, if you're going to buy a Velcro wrap, which is what I recommend, you would be getting a stocking. And there's a lot of different types of stockings. A lot of times these stockings are already going to give you the 20 to 30 type of compression alone. And a lot of times the wear, the actual threading has silver in it. So it's great for any type of wound care that we're going to be managing, open wounds, even weeping for folks that have the vascular insufficiency and the edema and some of the eczema related to the open wounds, and that we're getting the dermal damage from a wound perspective. This is the beginning. So you'd actually be slipping this on your leg, and then you'll be wrapping on top of that. There's really two core layers to compression therapy. You're going to be having a stockinette or stocking that has a compression that has some sort of silver banding or my antimicrobial aspect that you directly put your leg into. So literally, folks that get into this, it goes right on the leg, and it's like that. So it would cover the feet, which is great because a lot of times feet are not involved, but we want to compress so that we don't flush fluid into the feet. So this type of compression is very impactful for the lower grade levels of Lipo Lymphedema, Lipedema. If we are now in a much greater situation where, let's say, you feel like you might be holding 60, 80, 100 pounds in a limb, or even in that kind of lower trunk area, or even in the pannus region, then we're going to have an additional layer where we might have a bandaging wrap where it's kind of foam wrapping. There's a lot of different foam pieces. I use foam wedges to kind of contour the leg. For the most part, lipedema and lipolymphedema, the legs mirror each other. So I don't always see folks where it's just left side versus right side in my traditional lymphedema cases. It does happen sometimes. The left leg always tends to be more swollen, more fluid filled. So it's not uncommon for us maybe to utilize custom wraps for the left leg where the right leg will still fit normal sizes. I use compression wedges and particular type of foam, and it's different per every case, but I use those foam wedges to continue to create this contouring shape. So what that does is allows me to get away from that kind of marshmallowy type of rounding, and then we get those creases. I use the foam to push everything forward and up. And the foam is great for minimizing the fibrotic tissue. I had mentioned in my first video that I am doing specialized 30-minute phone or video consults with folks to specifically work out foam measurements, where to place the foam, tailored approaches to management at home. This is a very special offering. It's $40 for 30 minutes, and this will give you a really extensive plan to use all these different garments. But what I want to do is communicate things you can do instantly. If you want a little bit more tailored, because a lot of times that is necessary, we can get into that. So the second layer, if we are not doing any type of foam wraps, is this actual compression wrap. And there are a lot of different types of wraps out there. They're Velcro. They're pretty thick. If you can see that thickness, and there's a lot of give. I mean, it takes a lot of effort to kind of pull it, which is great because this gives us the resting compression as well as working compression that we need. Now, you may have heard the term resting compression. That's simply in a static state. So literally just having your leg in this, doing nothing, no muscle movement, you're going to get the compression. So folks that are bedbound or disabled because of the lymphedema and the swelling in the lipedema case, they're going to automatically get compression just by being in this. And then on top of that, some cases I might use bolstering and other larger wedges to actually enhance the compression on one side or the other. But this, in working state, we get up to 20 parts of compression. So we usually see the gauge of 20 to 60 mm, and this is basically a measurement of compression and force and pressure. And so movement inside this is constantly pushing and forcing fluid up, which is one of the reasons why we say compression is great, especially if you're mobile and exercising and active and going to work. Wearing compression garments throughout the day will be helpful for continuing to move the fluid up the body, up the torso. And then also resting, you're still gonna get this. One of the most impactful things that compression wrapping does is it keeps the state contained. Why this is so important with lipedema or lipolymphedema is the nature of swelling by degree of the lymph fluid retention and the fat cells enhanced fluid containment is we actually need to contain the fluid significantly. And so by compressing, we stop the progression of the state. And then once we stop it by compressing, then we can start to really get into our decongestive therapies. That's what we call it as lymphatic therapists, as lymphedema specialists. We're doing decongestive therapy. We're therapeutically compressing and now pushing the fluid up. We're starting to manage wounds. There's wound care involved. That's going to be another specific course that I provide apart from some of these videos of wound care, because it's huge, 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 and will minimize your cellulitis and septic state and really minimize the diabetic and venous wounds. But specifically to this topic, what we find is that by compressing, we're minimizing the expansion of the limb or the abdomen, and we are now starting to manage the actual tissue and texture changes of that limb. Sometimes the side, the flanks, lower flanks, upper butt, they get really hard and red. The redness starts to go away as we get better circulation. We see enhanced lymphatic flow. Compression is really the only way to go with that. So this is crucial. I'll provide some links down below to some of the brands and products that I use. I'm a huge proponent of compression therapy. It is what allows us to have such a greater effect, and it's something you can manage. If you have the commitment level to do anything to get out of your current state, compression wraps, this type of wrapping and binding of your limb will greatly have a positive impact. If you also are dealing with osteoarthritis of your ankles, your knees, and your hips, compressing literally from your foot all the way up your calf, there's a knee component, and then up to your thigh, will greatly minimize the fluid that is causing a lot of joint-related pain. And what I find, most of my cases with lipedema or lipolymphedema, they have intense excruciating pain. That goes away. Now, I'm very serious when I say this. It doesn't go away immediately, and it will be painful and uncomfortable being compressed. But if you can manage through that pain, and I have some options as well in terms of pain management, then you can move the fluid up your body and start to compress so that we get past that nerve-related pain. Once we get past that pain, now the sky's the limit in terms of what types of treatment plans we do. And that's when I started to engage wedging. That's when I started to engage the different type of internal binding and compression therapy on top of just this type of static state compression wrap. I want you to enjoy life and to not feel like this is a life sentence. So I hope this has been impactful, empowering, and educational. Thanks everybody for your time. Have a wonderful day and stay tuned to the third episode coming out next Tuesday.